Hello everyone, and welcome. I'm Dr. Hana Sasaki. If you're watching this today, there's a good chance you've caught yourself glancing down at your legs and noticing those twisting, rope-like blue veins or the delicate webs of red and purple lines that seem to have shown up overnight. Maybe your legs feel heavy by mid-afternoon, like they're carrying sandbags instead of simply carrying you through the day. I want you to know something before we go any further. You are not alone, and this is not something you simply have to accept as the price of growing older. In my practice, I see patients in their 60s, 70s, and beyond who still want to garden with their grandchildren, take walks along the shore, or simply stand in the kitchen long enough to cook a good meal without that deep, aching fatigue. The good news is that we understand exactly why these veins appear, and there are practical, evidence-based steps that can make a real difference in how your legs feel and how your days unfold. I often tell my patients that one of the simplest yet most powerful changes they can make is something I call the micro-movement habit. We'll talk about that in detail shortly, but first, let's gently unpack what's actually happening beneath your skin so you can work with your body instead of feeling like it's working against you. Your heart is an incredible pump, sending oxygen-rich blood all the way down to your toes. Then that blood has to fight gravity on the long journey back up. To make that return trip possible, your veins are lined with delicate one-way valves. Picture tiny hinge doors that open when blood is moving upward and snap firmly shut to stop it from sliding back down. It's an elegant system that has served you well for decades. But as the years pass, those valves can lose some of their crisp efficiency. The walls of the veins may stretch. Tiny amounts of blood begin to leak backward and pool. That pooling creates pressure. Over time, the pressure causes the veins to bulge, twist, and become those visible varicose veins many of us recognize. The smaller spider veins you sometimes see on the surface are close relatives. They're often the result of the same underlying pressure pushing blood into the tiniest vessels near the skin. More than half of us will notice some form of this by our mid-50s. For women, pregnancy, hormonal shifts through menopause, and simply the loss of elasticity that comes with time can all play a role. Genetics matter too. If your mother or grandmother had prominent leg veins, you may be more likely to see them as well. But knowing the cause is empowering, because once we understand the mechanics, we can support the system nature gave us. I remember Margaret, a 68-year-old retired librarian who came to see me last year. She had always been proud of her independence, but she told me her legs felt so heavy after her morning volunteer shift at the local library that she had started turning down invitations to walk with friends in the afternoon. She said, "Dr. Sasaki, I thought this was just old age settling in." We looked at her day, long hours standing at the circulation desk, then long hours sitting while she read in the evenings. She was essentially asking her veins to handle gravity without any help from her muscles. Within 3 weeks of making a few consistent changes, she sent me a photo of herself on a sunrise walk along the trail near her home. The look of quiet pride on her face is why I do this work. Before we go further, I want to speak plainly about something many of you have probably seen while browsing late at night. The internet is filled with advertisements for pills, creams, and herbal blends that promise to erase varicose veins or magically strengthen vein walls. As a physician who reads the actual clinical studies, I feel a responsibility to tell you the truth. We have looked carefully at horse chestnut, grapeseed extract, butcher's broom, and many other popular supplements. While some show very modest effects on swelling in certain short-term studies, the majority of high-quality evidence simply does not support meaningful, lasting improvement in the size of varicose veins or the heavy aching feelings so many of you describe. I would much rather you invest your time and money in approaches that work with the actual physics of circulation rather than hoping for a miracle in a bottle. That honesty I found actually brings my patients relief. It frees them to focus on what truly moves the needle. So what does move the needle? The single most effective tool you already own is your calf muscle pump. Think of your calf muscles as your leg's built-in second heart. Every time you contract them, they squeeze the deep veins and push blood upward. When you sit or stand motionless for long stretches, that pump goes quiet and pressure builds. This is where the micro-movement rule comes in, and I truly believe this one habit can change how your legs feel by next week. Here's how simple it is. Set a gentle reminder on your phone or simply decide that every 20 minutes while you're watching television, reading, or working at the computer, you will move your feet. Point your toes down toward the floor, then flex them back toward your nose. Do this 10 or 12 times. That small motion activates the calf muscles just enough to get blood moving. If you're standing at the kitchen counter chopping vegetables, shift your weight gently from foot to foot or rise up onto your toes and lower back down. These are not strenuous exercises. They are respectful conversations with your cardiovascular system. When you've been on your feet for a long while, give yourself permission to sit and elevate. Prop your legs on an ottoman or even on the couch so your feet are above the level of your heart. 10 to 15 minutes is often enough for gravity to help drain the pooled blood. Many of my patients tell me this simple act takes their legs from feeling swollen and restless to noticeably lighter. One woman in her 70s said it felt like someone had turned the volume down on the discomfort she had accepted for years. Now let's talk about compression stockings. I know some of you roll your eyes at the mention of them. They can be tricky to put on, especially first thing in the morning when fingers aren't as nimble. But the clinical evidence for them is strong. Medical grade compression applies graduated pressure that is strongest at the ankle and gentler as it moves up the leg. This pressure helps the veins stay narrower so the valves can close more effectively. You don't need the heaviest medical compression right away. Start with 15 to 20 millimeters of mercury. Look for open-toe styles if that feels more comfortable. Many companies now make them with softer materials and easier grips at the top. Put them on first thing in the morning before swelling has a chance to build. Think of them as gentle, all-day support rather than a medical device. Many of my patients say they forget they're wearing them after the first few days. I often ask people to look at their daily rhythm and make one smart adjustment. If your legs feel heaviest in the late afternoon, protect that time. Schedule your longer walk or gardening in the morning when your veins have had all night to recover while you were horizontal. Then, before dinner, give yourself 20 minutes with your legs up. These are not grand lifestyle overhauls. They are quiet acts of self-respect that add up. Exercise remains one of the most powerful medicines we have. The key is choosing the right kind. High-impact running or jumping can sometimes jar already sensitive veins, but low-impact movement is pure gold. Walking, swimming, and cycling keep the calf muscles working through a full, gentle range of motion. The contraction and relaxation literally milk the veins and keep blood flowing. You don't need to become an athlete. A comfortable 20-minute walk after breakfast can be transformative. Swimming gives you the added benefit of water pressure gently supporting your veins from the outside. Stationary cycling while you watch the news lets you move while resting the rest of your body. The goal is consistency, not intensity. Your veins respond to regular, respectful movement far more than to occasional heroic efforts. While we're talking about daily habits, let's also be kind to ourselves about weight. Carrying extra pounds increases the pressure inside your abdomen and, in turn, inside your leg veins. Even a modest reduction in weight can ease that burden. Staying well hydrated keeps blood thinner and easier to move. Reducing excessive salt can help limit swelling. These are not drastic changes. They are the same gentle practices that support every part of healthy aging. I also want to speak to the emotional side of this because I see it every day. Many of my patients, especially women who have cared for everyone else their whole lives, feel a quiet embarrassment about their legs. They tell me they avoid wearing shorts even on the hottest days or hesitate to join friends at the pool. I want to offer you a different perspective. These veins are not a personal failure. They are the result of decades of service. Your legs have carried you through raising children, working, comforting others, and living a full life. When we reframe the conversation from how do I hide this to how do I support my circulation so I can keep doing what I love, something beautiful shifts. The shame softens. The focus moves to possibility. You begin to see small improvements as victories worth celebrating. Let me share another story. Robert was 72 when he first came in. A former postal carrier, he had spent his entire career on his feet. By the time he retired, both legs were covered in varicose veins and he had developed brownish discoloration around his ankles. He was skeptical that anything but surgery could help. We started with the basics: compression, elevation, daily walks, and ankle pumps while he watched baseball. 6 months later, he told me he could stand in his garden for an hour without the usual burning ache. More importantly, he felt like he had regained a sense of agency over his own body. Of course, there are times when home strategies are not enough. I want you to know the warning signs that deserve prompt medical attention. If the skin around your veins becomes hardened, shiny, or changes to a dark reddish-brown color, that can signal chronic inflammation. If you develop a tender, cord-like area that feels warm, or if you notice an open sore near your ankle, please don't wait. Sudden swelling in one leg, especially if accompanied by pain or shortness of breath, should never be ignored. These situations can point to deeper issues such as phlebitis, skin breakdown, or even blood clots that need professional care. Early evaluation by a vein specialist or vascular doctor can prevent complications and give you access to treatments like sclerotherapy, laser therapy, or minimally invasive procedures when appropriate. There is no shame in asking for help. In fact, it's one of the smartest things you can do. As we near the end of our time together, I want to leave you with a shift in thinking that has helped so many of my patients. Stop seeing your legs as a problem that needs to be erased. Start seeing them as a cherished part of you that has worked hard for decades and now needs a little thoughtful support. Building better vein health is like tending a garden. You don't see dramatic results after one day of watering and weeding, but the cumulative effect over weeks and months is undeniable. Your veins may not disappear completely. That's okay. The real victory is waking up without that heavy, restless feeling. The victory is being able to walk further, stand longer, and participate fully in the life you want to live. Many of the patients who improve the most are the ones who finally stop searching for a quick fix and start respecting the beautiful complexity of their own circulation. They embrace the micro movements. They elevate without guilt. They walk not because they're supposed to, but because it feels good to move blood and oxygen through a body that still has so much life to enjoy. If this conversation has resonated with you, I hope you'll take one small step this week. Maybe it's setting that 20-minute timer on your phone. Maybe it's buying one pair of comfortable compression stockings and committing to wear them daily. Perhaps it's simply promising yourself 10 minutes with your legs up before dinner each night. Whatever you choose, know that it matters. I would love to hear about your small wins in the comments below. When one person shares that their legs felt lighter after a week of ankle pumps, it gives someone else the courage to try. We truly are in this together. If you found this helpful, please consider sharing the video with a friend or family member. So many people suffer in silence, believing these changes are inevitable. Knowing there is a clear physiological explanation and a practical path forward can be an enormous relief. The single most important takeaway I want you to carry with you is this: your calf muscle pump is one of your greatest allies. Use it often, support it daily, give your veins the assistance they need to keep carrying you through a full, active life. We've covered a lot today, from the intricate design of your vein valves to the simple habits that honor how your body actually works. I encourage you to save this video and come back to it whenever you need a reminder or a fresh dose of encouragement. Thank you for spending this time with me. It is truly an honor to be part of your health journey. Your legs have carried you this far. With a little care and consistency, they can carry you comfortably for many beautiful years to come. Take care of yourself. Move when you can. Rest with intention. Listen to your body with compassion. And remember that even the smallest consistent habits create the biggest changes over time. I'll be reading your comments and cheering you on. Keep moving gently. Stay curious about what your body can do, and I look forward to seeing you in our next conversation.